Good afternoon, everybody. Thank you so much for joining us. Welcome to today's NTTAC session entitled Minding Your Business, Reaping the Rewards of Family Engagement. We're so happy that you are here and taking time out of your busy schedules to join us. Before we get started, we have a few housekeeping items that we have to go over with you, but we would love to learn more about you in the chat box. So if you could share your name, your role, your organization, and where you're located, we'll know who drove the farthest to get here today. Thanks so much. As part of our session, we must provide you with this disclaimer. The presentation was prepared by NTTAC under a cooperative agreement with SAMHSA. And while this event is supported by SAMHSA, the contents are those of the authors and do not necessarily represent the official views of SAMHSA, HHS, or the US government, as you've probably heard on a few other calls this year. So while we hope there are not any security issues that happen, in the event that any may occur, this session will immediately end and you'll be notified by email how to rejoin the new session. So we're really hoping that doesn't happen. So thank you again for attending one of our NTTAC sessions. Listed here are all of our incredible national partners that have come together to utilize their expertise and their subject matter knowledge to help inform the field by creating products, resources, and sessions like this one to enhance the behavioral and mental health fields. And you can see here as a center, our vision is that all children, youth, and families living with and impacted by mental health challenges will have access to the resources and opportunities they need to thrive in a comprehensive and equitable system of care. We serve a wide cross-sector audience, including everyone from state leaders to providers, to school workforce, infant and early childhood providers, community-based providers, peer supervisors, family partners, youth partners, and many, many more. Our services range from individual consultation to more in-depth sessions, like the one we're offering today, to peer learning exchanges and tools to help you. Our aim is to really create those outlets for communication, collaboration, and resources being shared amongst all of us. So please also make sure to check out all of our resources and archive presentations on our website. And you can visit our website at www.ntacmentalhealth.com. So we have some commonly asked questions here. Before we get started, we want to address some of these that come up during our sessions and let you know before we get started some answers to these questions. In the follow-up email for today's session, you will receive a certificate of completion, a link to the recording of the session, and a copy of the slide deck presentation that's being shown today. You should have already received a copy of the slide deck in the reminder email that was sent out earlier, but if not, you will have it after today's session. So welcome again to today's session. And now that we've made it through those housekeeping items, I know the NTTAC staff will be perusing all of the chat box information that you put in there. And again, we're really glad that you've joined us for Minding Your Business, Reaping the Rewards of Family Engagement. Thank you so much. Next slide, please. So last year, we decided to pull together all the research we could find at that moment, or maybe all the research we had time to cull through at that moment, to pull together this graphic to depict the various segments of a system and how they sort of interrelate and interact with one another. And today's conversation really is focusing on how everyone's business has something to gain by engaging families. And I know many of you have probably attended sessions that are focused on strategies for engaging families. And this is really the why behind it all, why it's important. It is important, of course, to do good work and from our heart, but to really know the outcomes that come from that really help you think more strategically about how you can engage families in a variety of ways throughout the system. So engaging them in care, engaging them in agency decisions, in program design and evaluation, and engaging them at the policy tables. So we're going to talk today about what those outcomes look like in all of the various aspects of the system. And this design intends to depict how whatever happens in one facet of the system, sort of that color bleeds over into the next. So you'll see the child and youth area is blue, but when blended with the family, it's various shades of blue. Agencies or facilities then feed into the outcomes around managed care, to what's happening in the community. And then hopefully what's happening with children and youth makes it all the way around that circle to the systems. And that color purple then bleeds over, hopefully, to changes by the system that either change what's happening in programs, or to fund more programs, or to develop new programs that will meet the needs of children and youth better. So everyone's business has something to gain. The reasons that we pulled this together are many. Our country is at a tipping point when it comes to children and youth getting their needs met. The demand far outweighs the supply. You know that. You're here, you work in it every day. We have workforce challenges going on. We have funding challenges going on. Though there may be a lot of funding coming into systems from lots of places, they're not always targeted where we know they could do the best or have the best outcome for children and youth. And across time, changes in language, population focus, expectations have led to less financial support for and less attention to children, youth, and families. So I'll give you some examples of that. Shifting language away from parents and families to caregivers. It's sort of like watering down the soup, right? So you have all these ingredients and then you put another ingredient with it, but you don't necessarily get that flavor or that response for that ingredient that you would like people who are eating the soup to give you. So shifting that language away from parents and families to caregivers has sort of shifted the viewpoint of many people in systems, moving from cross-system solutions language to focus on across the lifespan language. One more way we see less of children. They're becoming more invisible in our systems and more highly visible on the front page of our newspapers. When over 1/3 of the suicides in the country are between the ages of 15 and 35, to me, that's a very short lifespan. So we have to really begin to pay attention to children and young people. And we've moved from language around evaluation to language around inputs and outputs rather than outcomes. So we did this piece of work hoping to focus more on outcomes. And lastly, because we really need more research-based advocacy. Many times people talk about, well, we don't know, or we don't have research on. And so we pulled all this together. So those of you who joined us today can really look at the research that we've discovered throughout the items that we've been through. Next slide, please. Thank you for moving my slides today. I appreciate that. So we're now up to 65 researchers identified in the work that you will see today. I recently met with a few of them and 3 people who are not even yet on our slide. And they've all committed to begin the process of incorporating information from newer studies. And we hope to have an even more compelling version of this presentation available to you in the winter. And as we update it, we'll make sure that it's put out there for you so that you will have even more research in your advocacy for how you can engage families or how you need clinical programs funded, because engaging families in that work, in the clinical side of the work, really does yield better clinical outcomes, and you can then advocate with families to help that happen. Next slide. I think we're ready for that now. Thank you. So I think regardless of our service, our business model, our missions, that we all come to this collectively, we share similar wishes, right? We have a need to stay solvent because we are all doing the really important work for children, youth, and families. We need to meet the ever-growing demand with what is currently an insufficient workforce. That's not an aim of ours. We would hope that it would become a sufficient workforce. And we want to see positive outcomes for children, youth, and families. So I'm going to take a couple of minutes here, probably even more than that, because I want you to have time to look at the outcomes on this slide. And you will have the slides, and you will have the citations that go with the slides. But when you think about the outcomes for children and youth, and you think about decreased isolation, their adjustment, functioning, and quality of life being improved, reducing the risk of mortality, reduced rates of research, of relapse, recidivism, and deeper engagement with child welfare and juvenile justice. You're very welcome, everyone who's saying thank you in the chat box. I want you to look at those last few bullets, 2, 3, 4, 5, 6 of them, I think, at the bottom in italics, all relate to engaging fathers. Don't forget, this is research about the positive outcomes. And those are outcomes around engaging fathers. So thinking, particularly those of you who are working in the clinical side of things, thinking how all of this relates to your work. How does it make your work better? How does it make you have more success? How does it make you feel more satisfaction in the work that you do, right? Because we can't just focus on workforce development in that we need to employ more people. We need to keep the great people we've got. So thinking about these outcomes and how they impact whatever type of service you're providing. And I can't think of any system that would not think it's really important to achieve those kinds of outcomes. When we think about families, improving stable living situations, so important today. So I don't know about where you're living, but being homeless or not having a stable living situation is just a growing problem. I know it is where I live. Decreased parenting stress means that parents are more able to deal with what's going on and to find resources and be comfortable in reaching out for help, having more confidence. Again, finding access to insurance. Families to families do this. I'll show you in a few minutes a slide around the roles of families that you might begin to think about to help you achieve these kinds of outcomes too. But reduce parenting stress. Teen males who live with fathers are less likely to carry guns and deal drugs, and reduce sibling discord are 3 things as a result of engaging dads. So I have 2 daughters and 2 sons, and so I have to also be an advocate for dads. And it's really important, I think, that we begin to think creatively. We have through NTTAC, we've provided some great information on how to engage dads in your programs. When we talk about earlier access to service and increased satisfaction of staff in their careers, when you talk about improved client satisfaction, and improve data collection so you can make better decisions about your programs and what you need to do with those. I think there's a lot of power in that. And you're right, whoever just put that in the chat box, about it's important to understand how to engage families where they are with what they need, and how first part of engagement is really listening. Thank you, Ashley, for sharing that information around fathers and fatherhood. And managed care companies, increased enrollment. Let's face it, most of our states have managed care contracts, whether they're for physical health, behavioral health, specialty services, specialty medication services, all sorts of services. So it's important to think about how those positive outcomes at agencies then reflect in managed care. So being able to have better stewardship of resources, return on investment means an opportunity to reinvest in the kinds of things that are important for children, youth, and families. And you'll see there, it yields better clinical outcomes. So whether that's in your agencies and in managed care, both, better clinical outcomes. So if you're working under a contract that gives you reward for quality, or you're just simply looking to up the opportunity to have better clinical outcomes with folks, engaging families can help you get there. So today's conversation is the first around this topic specifically, and will be available to help you as you need it, if you need to think through ways in which to accomplish this. So when we engage families, and we've done all of these wonderful things, or even any of these wonderful things around the clock, we get back to the community, because we can improve community tenure if families are engaged in the decision making and they understand their opportunities. Right now, across the country, states are overwhelmed with what families are demanding or needing, because the needs are ever increasing for their children, because their needs are not able to be met as early as possible. So there's a great request for out-of-home care or residential care, whichever levels it may be in your state. And as you think about, keeping people in the community, families need to know what they do have available, and how you can create things together that will help them get their needs met at home and in their community, because the waiting lists are not getting shorter, and we lose the opportunity to serve children when they need it every day. So the outcomes for systems are more effective and efficient use of state and federal resources among systems. These outcomes are not only related to mental health systems, right? They're related to all sorts of health systems. Reduced out-of-home placements, less time out of home. Self-efficacy reduces over-reliance on services, and having good data for decision-making, not just numbers, but really, what does it mean, and how did families help interpret that data? What does it mean to them when they see those numbers? Are there reasons for those numbers? So really engaging them in all of those levels of discussion is important. So we can go to the next slide. And this slide really provides some examples of roles that families and their family organizations can play to help you get to these outcomes. So some of you probably already fund some of these roles, and some of you may not have been able to do that yet. Navigation is an interesting role, because many times people think they only need to fund navigation, or they only need to have families doing navigation. Navigation is one really small piece of what families need to be able to do for one another, because they are the best engagers of families. So if you can have families who are doing the engagement, you'll have even stronger engagement and longer lasting engagement from those families. So participating on planning teams, helping link people to life skills and resiliency building activities, linking to housing, educational, social supports, knowledge about education and court processes. That's a scary place to be if you're a family facing that. And I can say that because I've been there. And there is nothing that defeats your spirit more than seeing your child in shackles. And so when other families can help you be prepared for that, that's powerful. So if you get those kind of linkages, you have all sorts of functions around here. Performing ambulatory follow-up functions. That's another way you can get families to engage families in that. Helping with discharge planning. Helping to coordinate those services between out of home and back in home. And on the way out of home. So, we always have the best laid plans, right? Sometimes fall through. And so in working with families, the outcomes aren't necessarily what you want them to be when they're released from the hospital on Friday afternoon, and they have their prescriptions have been called in and families come and pick them up, but no one has asked, do their scripts need prior authorization? And so they could maybe be on new medications and go home and for 3 or 4 days, not even have access to their meds or longer. And so when you think on the clinical side of things, the kinds of questions you can ask or the kinds of conversations that you can have with families to make sure those transitions are smooth. And on the other side, helping families transition into other areas of care that may be out of home, helping them know the right questions to ask and how to get the right information so they're better prepared. I know a lot of people think that families are simply relieved when their children are sent out of home. That is not necessarily so. They may feel some level of comfort, or that less stress is on them to make sure that their child is safe. But there's a lot of other things that accompany those kinds of moves too, such as trauma. There's trauma in that move. There's a lot of fear in that move, and there's a lot of guilt in that move. So I'm probably giving you more food for thought than you wanted, particularly for your clinicians today. But those are some of the functions you can begin to think of as you try to engage families and to employ families to engage families. So can we go through the next few slides a little bit slowly, just go ahead and scroll through them. You can see all of the areas here that offer you and the next one and the one after that. You can just scroll through them and you'll have this and you'll be able to look at it. And then hopefully you'll have a new one sometime this winter when we get done working with other researchers who are helping us include a lot more of the more recent research that's been done. So I'm wondering if you have questions. I haven't looked at the comment box, and thank you for taking the slides down. I appreciate that. Questions, comments, your thoughts. What did you hope to get from today's conversation? Let's talk about that. Anyone?
Yes, I'm a parent partner and we work in teams in LA County to provide mental health services. And one of the things that we face is helping the team understand how important it is to engage the caregiver, whether it's a family member, a parent, or a foster parent. I don't think there's enough emphasis in that, and they don't understand the importance of engaging the family, because without the family, there's no progress that's going to be done if you focus only on the child. But yet they don't know how to. They also don't, they need to learn to listen to also need to learn to listen to the caregiver, really listen, because they try to implement, like say they want to do a behavioral plan or something, but they don't listen to the ability of the parent providing rewards or consequences. Doesn't have to be monetary. Also trying to override authority. Oh, don't take their cell phone away. That's one of their coping skills. But that's a parent's prerogative and a caregiver's prerogative to do so. It's their home and their rules. And sometimes even like they want the parents to write journals of stuff, but never taking the opportunity to know if mom even knows how to read or write. How many times that comes out and you're almost at the end of services. And then they say, oh, well, they don't participate or they don't follow through. It's not that they don't, they can't, but you've never bothered to listen, and I think there has to be a lot of training in that.
So you're absolutely right. It does not come naturally. And we say family engagement like it's a really easy thing to do. And it's one of the hardest things you'll ever do. And I hope when you look at those outcomes that you can use that as a tool to help them understand how it benefits them to engage families. It's not just another piece of work that's piled onto your already overburdensome paperwork and scheduling conflicts and waiting lists and all the things and shortage of staff. What it is a way to help remedy those things. And so I would encourage you to number one, share this information with families, right? Families need to have this information because there's power in it. There's power in them understanding how to have a conversation with the people who are maybe not listening and help them reframe in how it benefits them as well as the child and family. And then I think, to share some real strategies, and we've had some NTTAC events that have focused on engaging families, how to really meaningfully engage families. And we need to do that in a way that's not only about people who play a role as mom and dad, but we need to do that across cultures, across life experiences. We need to know engaging families who are engaged with child welfare may be different from families who are engaged with juvenile justice. There are feelings of safety and concerns who come up for those families who are involved with some systems that they have concerns about. And so really thinking about who are you serving is one thing, who are you not serving is another thing, and really paying attention to both of those, paying attention to people who are underserved and overrepresented in those systems that we really don't want them to go to. So really paying attention to Black and Brown families and really paying attention to strategies and listening to what works, because what works for me may not be the same as what works for Charlene out there in San Diego or Lisa, or Scott. We all have things that work for us, ways to approach us. We all have our own priorities. We all have our own cultures, and the culture of being a single family, a single parent, that's a different culture too. So thank you for bringing that to our attention. And I encourage you to visit the NTTAC website to get recordings from other presentations that have talked about those strategies. Anybody else? I hope that was helpful. Any questions in our chat box? You're welcome.
Right. I also think that we, as a nation, we really have to advocate for the children's system of care. I know, especially in my county, in LA County, a lot, and in California, emphasis has been put on the homeless and trying to solve the homeless situation. Right now, there are bills trying to take away money from the system children's of care to put it into the homeless population. But they don't understand that if these children don't get services now, they will be that homeless population in 5 years. But they're not seeing it. They're just seeing the now, and we really need to advocate for families and the children's system of care.
It's very interesting that the focus has never been very positively on what I'm going to use a broad term, prevention. And the way I'm using it right now is not about those wonderful prevention programs that we have or services that are available. It's about preventing the need for a lot more adult services, because we know when the needs of children are met, when they arise, that the outcomes are better. And we know that many times if they learn the skills and strategies around lots of things, or have the right clinical interventions when they need them, they are not going to become adults who need that same level of service as many adults, do right now. And we see, I talked about the invisibility of children. So raise your voice, raise your hand, share information as much as you can, everywhere you can, because we really need to focus on children in this country. And until this country says children are valuable, children are important, children are not forgotten because they become disconnected or are spending time isolating themselves. Until we hear that resounding cry that children are important, how would children know they're important? They may know it from their families, or they may hear it from their families, but I think our systems have to walk the talk. Other questions, comments? Conversation. What's your biggest challenge? What's your biggest challenge in engaging families, or in getting which outcomes did we talk about that you'd like to get to, but you're not there yet? Have you got any of those outcomes that you wish you could improve?
My name is Sarita Davis. I am a family partner in North Carolina. And what I'm noticing with the different systems is them not understanding that, the families have these requirements for, like, say if their child is an out-of-home placement and trying to transition back home, they have the requirements that they need to meet, but also DSS are requiring them to have like stable income, stable housing, but the youth might be involved with DJJ as well. So they have to call out of work for that, call out of work to attend DSS meetings or DSS court, things of that nature. And then having other children in the home, may not have transportation, those things that, like sometimes the family are in survival mode and they're just trying to make it to the next day or to the next check. And they're not understanding that they're, placing the demand on the requirements versus really understanding like this is a human being, this is a family, these are the circumstances, and like we have to work with them with that. It's just basically the agenda.
Absolutely. And I think one of the biggest pieces of advocacy work is around helping those systems understand that when they place undue burden on the families, so when you keep piling it on and piling it on, it's a setup for failures, right? And so how can there be shared responsibility and shared reward in those positive outcomes? Because families will work with you. Families will give it all they've got, but sometimes they pretty much are depleted because they're not getting anything back that they need, or they're not even being heard. And so when we talk about, the positive outcomes from engaging families impacting your business, it does impact your business. It creates an overdrain on your business when you don't help families get to those outcomes. there's no shortage of families to be served right now. So. Next.
Hi, this is Jill. So I find that the lack of education of the systems of care is a huge obstacle for many families, because it's, like you're given a baby and they say, hey, here's your baby. Now, what do you do with it? You don't know. So here's your child who's now been diagnosed. What do you do with it? I don't know. So there's a lack of that. We have a family guidebook here that we made that helps families to navigate through those systems of care. It's been very helpful to some of our families. And so getting that education out to them, but not only them, but to also some of our providers who only see their one little, world. They don't see the full aspect of it. And I think we are putting more peer supports in place to say, hey, listen, you're not seeing their whole picture here because there's other things going on. And I think peers add a lot more to that discussion of, if you have an organization that is all professionals, peers are professionals as well, and they should be treated as that. But they have a different point of view when you're sitting in a meeting. They can say, hey, look, have you thought of this? Have you realized that this is what's going on? I had some of those same challenges with my family. And so we had to work it through. And this is, some of the things we did. Families, I know that, I lived through it as well. And I talked to the families I talked to, and they enjoy hearing the things that I messed up on and the things that I had success with. And so, it's just that back and forth. In fact, I have this one parent that calls me once a week for 30 minutes and all she wants to do is vent. So, I let her vent for 30 minutes. We get off the phone. She's in a happier mood, and, I give her a couple little nuggets and she's happy to go. So, but it's just that building that relationship and that rapport, and it takes time, and you have to look at all the many different angles and situations that people are in, not just the one that organization sees.
Absolutely right, Jill. Thank you for reminding us of that. I think we are all more than the door we come through that day, right? We have so many more things. We are part of a bigger world, and we're part of other people's worlds, right?
Right.
If we're from a family, it's not just us, and it's not just us and our child, right? Families are bigger than that. And it may even oftentimes be people who are not even related by blood, who are family. Mm-hmm. And so to look at people through the lens of the door they come through is a real disservice. And so there are real strategies for having those conversations when you meet families, right? Mm-hmm. Asking the right questions can help you learn a lot about the families that you're serving, right? Mm-hmm. And not probing or intrusive questions, right?
Right.
How's it going? What's,
right.
Tell me about your journey. How did you get here, right? And little by little, you learn a lot more about those challenges and can help families find other resources they didn't even know they existed.
Oh, yeah, no. So one of our programs here is RNAC, and they have a list of questions they go down. And I'm like, parents are not going to answer these questions. So I get on the phone and I sit there and I just chat with them for a little bit. And while I'm chatting with them, I'm secretly asking them the questions and I'm getting my answers, but I'm having a conversation with them to see exactly what they're wanting for their child, right, without having to say, so what do you think, what services your child need? And so it's really just having that conversation. And that I think is so important. With the systems of care, I'm building that around that. I could tell with, I've been doing system of care for work for 10 years. It's been a challenge, but it's getting better every time. Because now when I call up somebody, they're kind of understanding what I'm saying now. So it's a lot. You still have those times where you want to go strangle somebody because they're not listening.
Jill, education is key, and it's key across the board. It's not just for families, and it's not just for providers. So, and I think Sarita, am I reading that right? There's also a huge lack. I just lost that.
A huge lack of peers. Yeah.
Of the role of a family peer in agencies. And I think that's why you can use that slide, and we'll bring up a couple slides again in a few minutes if I don't create panic from my colleagues at NTTAC. But the slide that has, both the outcomes and the roles that families play. I think when you have those two slides, right? Those are the roles that families play. That's the job description. It's not about making coffee. It's not about, doing this or that or running errands or, these are the roles that families play. And so use that within your agencies and in helping other agencies. I'm not a clinician. I'm not a provider. And if somebody came to me, I wouldn't know how to do what I need to do if they came to me for a clinical reason. And so it's kind of,
all right, she's telling me bye.
kind of unfair to expect that people who are there for a clinical reason would automatically understand the kinds of things we're talking about today either. And many do, but probably many don't. And families are overwhelmed, and I think more today probably than ever. I'm going back to another comment. Richard says, agreed, but peers are not respected and treated as paraprofessionals. Venting is okay from parents. It is okay because you need to get to a space where where everything's leveled out, right? If you start with a level, everybody's at a level space, then you can move forward. But sometimes it's all of the distractions that are causing the venting, or the venting can be a distraction to moving forward, because the venting happens from very real things that families are feeling, that they're afraid of, that they're insulted by, that they're feeling demeaned about. There's a whole lot of things that families need to vent about. Maybe school's a problem. Maybe, other systems are a problem. We found out families that reach out to family organizations for the first time, the number one reason is because there's a problem at school. So wouldn't it be great if we could get those problems resolved early on, and find out the root causes? And someone just shared a file with you. So make sure if you want that file that you download it from the chat box. Other thoughts today? How many people are in a clinical role? Are there people in a clinical role here today?
I go back and forth.
Okay, that's okay. That's a fine line to walk. Good for you. Thank you, Kendra. Good. Thank you. So I'm wondering, from those of you, awesome, who do play a clinical role, are there things you would like to know? Is there like one little nugget you wish you had for a takeaway today? Or maybe even some future discussion that you'd like information on? We're looking to meet your needs. No? Other questions, comments, observations?
I just wanted to share that be patient with your caregivers. because a lot of them have been run through the systems and have learned not to trust them. And so it's going to take time and patience to try to gain their trust and help them see that you're there to help their child and them. And also to remember that many of these caregivers have gone through their own trauma and might not be ready to address the child because it can trigger their own. And so it's a family as a whole, not just a child, you know. And so just to be patient, that would be my advice to a clinician. And just because a parent doesn't open up the first time, don't stop trying, and to really just listen.
And leave the door open is really important too. Keep the door open for families. You know, many times agencies have, you know, all these rules about families showing up, families participating. You can't help families do that unless you know what it is they need in order to do that. So being able to have those early conversations around that are important. Anyone else? How about someone share in the chat box one of the best strategies you have for engaging families? How do you engage families in your organization? If you don't want to type, you can shout it out.
Pat, do you mind if I ask Jill to talk more about the PEEP program?
Go right ahead.
I
That'd be
don't know what that means.
wonderful.
So PEEP is an acronym for Parent Educational Engagement Partners. They are peer supports that have been trained through me. I have been a special education advocate for over 24 years due to my son, who's now 27, and him not getting services he needed in school. So I have been that advocate, even working here with the system of care and stuff for our families, because a lot of times they come in because of a school issue, and then they realize there's other things going on. So we engage them a lot of times first through a school issue. And then while I'm talking with them, I realize some other things are going on. And I then suggest maybe they look at, getting an evaluation, getting some supports from different service areas and that kind of thing. But PEEPS is kind of like, it's parents who have lived experience helping other parents go through the educational system, whether they need an IEP or an updated IEP, a manifestation hearing, 504 plan, whatever they need school-wise, if they need an FBA to do a good behavioral plan at school or whatever. So sometimes they come in through us and then go out through our other services or other organizations because that's the supports they need, or they come in through those services and they end up with us because we're the peers. And we work with them a lot one-on-one. And not only do we help them at the school level, but we help them in the home as well. So we are looked at as professionals. We sit at the table. In fact, I am a board member. And my daughter, who I think you met at the meeting in Baltimore, right? She was the youth voice for our board. And so, we are have a big voice, and we do tell everyone, hey, these are what families are going through, and they do listen. So that's really important because the people on the board are the directors of all these organizations in our community. So it's really good that we get that opportunity to share those families' voices. And sometimes we ask them to come to share it themselves. So
nice. Thank you. It's
Thank
great
you,
information.
Jill.
Welcome.
So Charlene says sharing her personal story as a family support specialist. We have a family wellness center, Hope says, in our school system. Dina says family events, in-home visitors that report to community wellness team, local referrals to community service. Shannon says, okay, hopefully we answered that about PEEP. And Nicole says that she loves that. Such a wonderful platform of support, education, and networking. Great. Any other ways in which you're engaging families? Do we have any anyone who's doing work engaging dads?
I'm a parent partner and I try to engage everybody, dads included. And sometimes there's a lack of a lot of male peer supports out there. Sometimes dads are hesitant because they feel that a woman's not going to understand their perspective. And I get it because we think very differently. I am lucky that I do pick at my husband's brain so that I can know ahead of time, how would he think about the situation and what would be the best way to present it. But I do wish that there was more male roles, even in the clinical with our teenage boys. There's such a big shortage of men in this profession. And my son was totally disengaged from therapy because he's 14, trying to do his identity, goes in and it's a female clinician who says, hi, dearie, how are you? Hi, and he was like, forget it, that's it. And he walked out and never came back, and so we do need a lot of more males and maybe a training on the male perspective.
And I think if you look in the chat box today, I think earlier, there's a link to some of that.
Yeah, I saw that, but I just wish that we can engage more males in this profession, either in peers, clinicians. They're highly needed.
Right. Advocates, that's a great word. Advocates, Jill. How about, is anyone doing a particularly good job with outreach to minority communities, or not every community has a huge population, so I understand that. But how are you working with communities that people think are hard to reach, but they're not really? Black and brown communities.
Indigenous communities, but not just from the
Indigenous?
United States, but from other countries.
Good.
Like in Mexico, there's a particular area that has like 250 different dialects. They have a very large community here. And I think there's only one translator for LA County for that particular language.
Oh my gosh.
And so it's very, very hard even to provide any type of services when they don't understand. And then some people take the child to translate when this is services for the child, so yeah.
Well, in that case, it's a huge challenge, Anyone
Hi,
do communities?
Sorry. My name is Kayla. I'm from the Big Island of Hawaii. I'm also a parent partner. And of course, living on the Big Island, basically, I can just tell you, I'm also of Native ancestry, or Hawaiian ancestry myself, but we have pretty much absolutely no resources for families. We have the basics of families, but very, very limited, right? And I think the best way that I engage with my families, especially like Hawaiian Native families, is I literally just exactly what was said, hear them out. And at some point I just asked them, what exactly do you need? What type of things, you know, within your families do you feel like that is going to be helpful to this process? You know what I mean? I'm constantly asking parents, like, I also work within the child welfare system myself, and been to the child welfare system, but always through the process trying to ask them if they understand, right? Like if they even understand what is being talked about, like if there could be any type of explanation or clarity, you know, is when going to court or when going to any of these types of things that they're getting this information. And a lot of times, just in general, families are not even understanding their service plan when handed to them, you know, from the very beginning. They're not understanding what it is they have to do or what the next steps is. So just constantly advocating for understanding and clarity, and then also using my own lived experience to connect and build that rapport and comfort, and just allowing them to know like that they're not alone through this process. I think that a lot the hardest part about being from the islands is that culturally we grow up with the mentality of like men are supposed to be strong, right? Men are built strong and they don't cry and they don't show weakness. So it's kind of like not turning away the fact that it's their beliefs is not valid, you know, but hoping to somehow incorporate new beliefs through the process, right? And so I think that's what I found helpful so far. But thank you for letting me share.
Of course, and our heart goes out to the other islands in Hawaii. I mean, it's been pretty horrific for all of you. So I want to again say thank you so much for spending time with us today. And thank you. Bridget has put in the chat box to take a moment to complete the survey. And I think we have a reminder of that you will need to re-register for the series as well, since a new year for us is coming up.
And don't worry, if you can't grab those links, they will be in your follow-up email as well.
Thank you, Ashley. So thank you, everyone. We appreciate it.